Recommendations to minimize COVID-19 transmission. Case study, a tourist accommodation. In this video, we will show you how to assess and manage the risk of COVID-19 transmission in a hotel. The COVID-19 virus is transmitted via 3 routes, essentially through aerosols, droplets, and to a lesser extent through contact with contaminated surfaces. The level of transmission risk depends on a combination of 5 factors: ventilation, safety distance, use of face mask, exposure time, and relative humidity. The combination of these factors and whether or not they are managed correctly influences the transmission risk level, which can be low, medium, or high. In the next few minutes, we will show you the risk map in a hotel and examples of situations where there is a risk of COVID-19 transmission due to the poor management of the 5 factors mentioned. These examples consider droplet and aerosol transmission of the virus, as they are the most common transmission routes and present situations of maximum risk. Furthermore, they will help you learn about the most appropriate preventive measures in terms of ventilation, safety distance, use of face mask, and exposure time. With regards to relative humidity, this should be kept between 40% and 60% in all instances by using air conditioning, humidification, and dehumidification systems. Let us now take a look at these high-risk situations of COVID-19 transmission and the recommended preventive measures in each case. Risk Node 1, common indoor areas, reception, lobby, corridors. The common areas of this hotel do not have windows, but they do have air conditioning that is turned on in hot weather. The common areas are open plans, but sometimes the safety distance is not respected. Employees wear face masks, although they frequently remove them in the absence of clients. Many of them do not use face masks, and nobody seems to control it. During peak hours, long lines are formed at the reception by customers checking in and out. Recommendations to reduce transmission risk. Ensure adequate ventilation. Keep the doors open, creating drafts. When the amount of renewed air is insufficient, activate the air conditioning to exchange the largest amount of indoor air for outdoor air. Avoid recirculation. At the reception, install protective screens to avoid contagion by droplets. Encourage employees and customers to maintain the safety distance. And monitor the correct and continuous use of face masks. Review and reorganize spaces and activities to reduce exposure time. For example, facilitate online check-in and check-out. Risk Node 2, buffet service. The buffet service is offered in an indoor lounge with air conditioning. The windows are closed to maintain a pleasant temperature. The service is assisted by hotel staff. This prevents customers from touching products and utensils and reduces the risk of transmission by contact, although it creates crowds and lines and exposes staff. The staff wears face masks, sometimes with a breathing valve that releases unfiltered air. Clients remove their face mask while sitting at the table. The buffet service generates lines of up to 15 minutes. Recommendations to reduce transmission risk. Arrange the buffet service in outdoor areas whenever possible. If the indoor lounge is used, open its doors and windows to provide air circulation even if the air conditioning is on. Customers are more likely to become infected by droplets or aerosols than by touching a surface. Therefore, make sure that no crowds or lines are formed and that safety distance is respected at all times. Also between tables. Provide staff with an N95 type face mask without a breathing valve and enforce staff to use them properly. We recommend combining it with the use of a protective shield. Encourage staff to avoid touching their face mask, eyes, nose, or mouth. Urge customers to put on their face mask when approaching the buffet tables. Encourage customers to stay in the indoors buffet area for the minimum time necessary. Furthermore, ask customers to sanitize their hands when entering the buffet area and tell staff to do it frequently. If the buffet area is self-service, provide customers with serving tongs along with their own cutlery. Risk Node 3, room cleaning. This hotel's windows cannot be open, so the cleaning staff cannot open the window as part of their routine when entering the room. Cleaning staff access the rooms when customers are not inside, and that is why their face masks are frequently removed during this task. The organization does not provide face masks to its staff, so the type of face mask they use varies by employee. The staff cleans each room in about 15 minutes. Recommendations to reduce transmission risk. Since the windows cannot be opened, turn on the air conditioner without recirculation. Avoid using centralized air conditioning systems that send the extracted dirty air to other rooms of the hotel where other people can inhale it. As a precaution, urge staff not to shake the linen when removing them, as they could spread infectious particles. Discard soiled linens in the cleaning cart or in a closed bag and take them to the laundry or to a trusted supplier. Perform cleaning tasks when the client is not in the room. Provide cleaning staff with N95 type face masks and enforce that they wear them even when there are no clients present. Furthermore, remember that the cleaning staff must wear gloves and discard them or sanitize them after each use. They must also wear protective glasses to prevent splashing. Cleaning products must have antibacterial effect, and cleaning equipment must be cleaned or discarded after use as appropriate. The aforementioned measures are aimed at minimizing the risk of droplet and aerosol transmission. With regards to transmission through contact with infected surfaces, it is recommended facilitate hand sanitizing among staff and users with soap, water, and single-use hand towels. Empty waste baskets daily, and keep the facilities in a clean and hygienic condition. This video only shows a summary of the most relevant recommendations for high-risk situations. There is a specific tool available to help you carry out a personalized risk assessment for your establishment. You will be given the most appropriate preventive measures to implement in each case, depending on the result of your risk assessment. We encourage you to learn more about this tool at www.iadb.org/tourism protocols.